Okay, I won't take it personally. Sorry, what was your name?
Tony.
Tony, nice to meet you.
Tony's the Director General.
Oh, great, nice to meet you, Tony.
There's a pretty good level of interest.
Yeah, it's excellent.
Okay, thank you very much for coming, and I'm sure a couple will still trickle in. It's my really great pleasure to introduce Joshua, who's going to talk about some really exciting new work that they are doing here. Joshua will introduce the work, which we think that has a potentially a huge, has a huge potential to improve the way we do our work, from helping us to design theories of change, to assessing impact, or simply to outreach. You're going to speak about all the rest of the stuff, so I don't need to say very much more than that. And then a colleague of Joshua is stuck in traffic, and then they'll be available for Q&A at the end of this. So, Joshua, over to you.
Thank you very much, Ravi. And thank you to all of you. It's always humbling as a relatively small organization to see a lot of people turn out to hear about our work and discuss collaboration and how we can take it further. A little bit more about me. I'm Joshua Holmes, Product and Innovation Officer, I think is my full title. But what that means is we started off as a very bespoke research project in Cambridge. A lot of experimentation driven out of a kind of, I don't know, antipathy towards survey methods and their limitations, perhaps using digital media to be a little bit less extractive about how we got information and data from beneficiaries and from citizenry writ large in Africa. And following that, there was a period of about 3 years in which we experimented and tested different models and different ideas for how we would engage with citizen bodies in Africa, and more importantly, how we would turn that engagement, those inclusive conversations in media such as radio and social media, into actionable social evidence, which would be of interest to organizations like ICRAF and others. And so my role coming in as a product and innovation officer was to consolidate the experimentation, the piloting, the loss leading work that we've been doing into a package of solutions that could be replicated and scaled, because we believe now that we've found a core of work that makes sense to, or solves a lot of problems across a broad array of sectors and geographies in Africa. And most importantly to that, I suppose, is that we are domain agnostic as a solution. You are the experts. We're here to hear and explain our methods, and then hear about the potential ways in which we can use those methods to solve the issues that you find in land management, in food and nutrition security. So yeah, we don't profess to have expertise in every domain that we operate in, but we really do believe in the model. It's easy to worry when you come to something on a Wednesday morning, on a short week with Friday being a holiday, that the audience won't be warmed up. But there was some footballing prowess that seemed to get people giggling, which is a nice organizational idea that I might take back to Africa's Voices. We're a smaller team, but it did look like a bit of fun. So that was nice to see. Yeah, so I think, so Shareth is the executive director. He's on his way from Karen. I think he's best to take us through the first piece of this, which is about the origins of Africa's Voices and the model. But I think what I might do is jump to the end, which is about how I see the applications of what we do to the work at ICRAF. My research background is in carbon markets, particularly a World Bank project around carbon markets and agriculture in Kisumu and Kitale. One of my first projects here was kind of shaping up how we would integrate the work that we do into agriculture, agroforestry, and the sort of unsatisfactory progress in those areas. So let me skip through these. There'll be some slight spoilers, but try not to look too closely. and also don't be daunted by the amount of slides. We've run quite quickly through them. So assuming that what we will have after Sharath has spoken is this body of knowledge about how we do cost-effective methods of engagement using interactive radio, or social media if it's appropriate, less so outside of Kenya. And assuming that those methods produce rigorous social evidence which can be used. And the social evidence is generated both specifically from program beneficiaries that we can encourage to participate in shows, but also from the wider community. Hey, Sharath. The argument is, okay, well, let me wind back then. We spun forward to the answer, but I feel like it's best to set up the question first. So. Great. So that's yours.
Okay, thank you. Thanks, Josh.
That's okay. That's yours too.
Okay, good. Great. Okay. I think that was as smooth a transition as possible. Can you hear me? Yeah. It's okay, yeah. First, two apologies. First to you all. I had to swap taxis midway from Karen, and so again, this is an age-old excuse. It doesn't cut it. But this is not how I would like us to start engaging with you, and so I apologize, and I also apologize to Josh because I put him in the hot seat as a result of all of that. So I'll get on with it. I've met some of you, and I'm really grateful for this chance. I'm Sharath Srinivasan, Director of Africa's Voices Foundation. I'm also an academic at Cambridge University, where, thank you very much, I direct a Center of Governance and Human Rights. It's within the Political Science Department and International Relations Department, but I have a background that's, I guess, more broader than that in the social sciences, in international development and economics. But I come to this work very much with a political science, governance, development studies orientations, just to give you a bit of background. So I think Josh has started at the end, which is, in a way, a good place to start because it's about what maybe is most relevant to you all. But what I want to do is sort of stop and go back a little bit to the beginning, because I see this seminar as a chance to sort of say, where are we coming from? How have we approached what we think is an important problem that needs a solution? And how do we think of it, at least at the higher level, in terms of research methodologies and design? So the starting point, I think, is just to note that this entity, Africa's Voices Foundation, which has been around for about 4 years now as an independent, non-profit entity, a UK charity, but with its operations based in Kenya, and looking to expand across the continent, has its origins in research that I have been leading for a number of years at the University of Cambridge. The main research project was this project, Politics and Interactive Media in Africa. So as you can tell, it has a very much an interest in politics. But the premise was the two major empirical changes on the continent in the last 20 years. The first was a real flourishing of the media landscape, which really followed liberalization in different forms in the 90s, and the real flourishing of FM radio in particular, but also, importantly, radio that was, and media that was in local language. And the second, of course, is the mobile phone, which has led to very different types of formats of media, where often audiences are engaging in the content and producing the content. So we talk about this in the social media space, but in the sub-Saharan African context, it's also vibrantly going on in traditional broadcast media. So you'll have formats of shows which are very discussion-oriented, very much about issues that matter to the audience in their locality, and they're very vibrant and successful shows. And we were not trying to intervene, we were trying to understand the phenomenon. Who participates? How do these formats of shows work? How do the media mediate these spaces? How do they convene them as discussion spaces where audiences have a voice? And how do authorities, and this is the politics side, respond to these spaces? Because they're like new spaces of public discussion and public opinion formation. And suffice to say, we learned a lot about these spaces, but one of the crucial things that we learned was that, that authorities take them seriously because they're spaces in which they kind of have to listen to what's going on, and also they're spaces in which they can legitimate themselves. So you have, within something that is already going on in the world, a phenomenon of interest to study and to understand its significance, but also to think about how it could be leveraged. And that's where the story of Africa's Voices sort of begins, as an applied project that sat alongside a basic research project in the social sciences. So a lot of it will come back to, I think, the premises of this core research. But if I look ahead to what we've tried to do since spinning it out 4 years ago, we tried to then take what we learnt about this phenomenon and how it might be able to address a problem in the world, which is, especially as regards ICRAF, reaching often geographically diverse and rural populations in ways that make sense to them, and that there's challenges of reaching those populations that are not just about engaging them, but also about credibly understanding citizen voice and using that to influence policy processes. So one way to think about this challenge, I think, is a sort of a pragmatic one. So robust research, and we talk about emergencies a lot, but I mean just talking about sort of often non-emergency contexts, I guess sort of remote contexts, poses challenges of validity and implementation. So we think about this often in the terms of public health, but this can be in other domains. And that is that, that the higher, the gold standard approaches in which you can be more confident regarding validity are harder to implement on the ground practically, and especially on an ongoing basis in a changing context. So you're often trading off the validity of evidence against the ease of implementation, and that includes its cost as well. And so these debates then exist between qualitative and quantitative approaches, between focus groups and surveys and RCTs. But in the social sciences, this is a real problem because the social context often is a far more fluid context to try and produce evidence from than a biosciences context in which you have a relative stability in the facts that you're trying to analyze. So in many contexts, there are lots of other new approaches coming out that are much easier to implement, but there's a question, I think, as to whether they're better or worse than doing nothing in terms of the quality of the evidence you produce.
Is lower and higher on the x-axis transposed?
In sense of?
I just wonder, on the x-axis,
yeah.
Is lower and higher transposed?
I'm not sure in what sense transposed, because I don't think the ease of implementation, it's just a...
Sorry, so are the new contexts easier to implement?
The context easier to implement. I think, no, sorry, no, in that sense, no, this is about the kinds of techniques that can be more implementable, but have questions of validity. Not that necessarily the contexts are easier to implement in, but that is the context in which these questions are asked more. Because in contexts where you can have easy implementation of traditional methods, it tends not to be as crucial. Sorry, yeah, I understand your point. So we've been looking at a range of different new methods that, and asked the question, to what extent are these, better than nothing, and can we establish credible alternative methods in this space? And so I guess I want to put this as that this is trying to come at this from a space of practical application in which we're asking questions about what new methods can do. And there are other methods out there. I mean, increasingly mobile-based, phone-based surveys, but in terms of the sampling techniques, they often fall short of what would be credible sampling techniques, especially in these contexts where you don't have robust sampling frames in lots of specific situations, not all countries. And within that is this method around interactive radio that I'm going to introduce and explain. And that's where we are aiming our work to date. Now, I guess what we then have tried to do is look at how, rather than thinking about research as an abstract process that's separate from a social reality, can you intervene into a social space or into a reality that allows for, say, interactive radio discussion and use that very process of engagement as an intervention that produces data that then is analyzable to produce evidence. So you're combining the very effort to engage with the desire to produce evidence. And that's quite different to a traditional research method where, for example, a survey or a focus group, which strictly speaking is an intervention into the social world, but is actually in a sense an artificial and abstract kind of process separate to that reality. So if you go back to the origins of the research in Cambridge, it was like these shows happen anyway, so can we sort of tap into them and curate them in certain ways that support a research process? And that is what's interesting about digital interactive media spaces, which is that, that they provide these opportunities to tap into existing spaces of discussion. And so you kind of, in crude terms, get 2 for 1, right, in the initial moment, because you can often use media and communications as a way to engage a population on a particular new intervention or a policy discussion around replanting or whatever it might be, or regreening. And so you might be using communications anyway, but can you turn the communication space, which tends to be a one-way broadcast out, into an interactive space, and then it can actually generate a range of different other benefits than just the message out traditional model of broadcast. So we like to think of this, going back to those gold standards as such, or established methods, as a combination of focus groups and surveys. So one of the benefits of focus groups is that in a very specific location you get a tremendous amount of depth of understanding and insight. A qualitative research process usually does. Not very easily scalable, certainly replicable, but at separate sort of cost, and the ability then to compare data is sometimes a challenge. And we won't talk about representativity because it's not a question that's asked in a qualitative interpretive model of generating evidence. It's a different model altogether. We can talk about that separately. And then, of course, surveys which don't have a tremendous amount of depth of analysis. The sort of the why question is not easily is easy to generate evidence on in a survey, but you can get a lot of more parsimonious data which can be valuable in terms of achieving scale and achieving a thinner level of understanding across a wider population. So in some crude senses, what we've been trying to do is think about these interactive radio discussion spaces as allowing for depth and scale. So allowing for deeper qualitative insight, but allowing for, if they're done in any particular geographic sort of space, a greater amount of scale than you usually would. The other thing is that we combine, it's a mixed methods approach, so we're trying to combine the qualitative richness of an interactive radio discussion, and I'll explain how that happens, with follow-up automatic collection of further sort of individual-based variable data like sociodemographics, practice data, behavior data. So what we tend to do is treat the radio discussion as if it's a large-scale focus group. So we tend to ask open questions and not try to prefigure the data we're collecting. So we'll often ask a broad question like, do you think that children in your community are at risk of polio? Yes or no, and why? And so we'll get an initial binary around what people think about the risk perception, and then we'll get reasons, and the reasons will be very rich. And because people are contributing to a discussion, they tend to give a rich answer, and this is something that we've tested over time, because they feel that they're contributing a voice that might be heard on air. So it's a sense for them of participating in a discussion rather than in a research exercise, although obviously we're clear about the fact that we're going to look at the data. So that data in terms of the yes or no and why will allow us to produce what we might call belief maps, where we can say, well, for people who think yes, these are the sorts of why reasons that they give for why they think what they do. And for people who think no, this is the sorts of why reasons. But because we've collected socio-demographic data alongside this, we can then look at associations between those maps and different demographic groups, or even sometimes practices. And that's when it kind of gets especially rich if you're looking at sort of behavior change related interventions. Now, because it's a sort of focus group style discussion, we're not looking at representativity in the traditional sense, right? We're not collecting individual data points. Those belief maps are about collective beliefs. So we'll be looking at the frequency of particular themes coming out when we do a qualitative research analysis of a large amount of data. What are the frequencies of themes that come out? So, for example, with the immunization polio point I made, what we looked at and found was a prevalence of reasons for not feeling your children are at risk of polio, because we live in the countryside, the air is clean here. This is a case from Somalia, and so our children are not at risk of polio. This is something that affects people in the city. We are really devout, and this is something that affects people who are not devout. And so that was a reason for not thinking your children are at risk. And that associated with, as you expect, people who were in more rural areas than urban areas. And it also correlated with people who had not immunized, who were parents who had not immunized their children. So in terms of programmatically understanding where to intervene, it's around this idea of cleanliness and purity that is actually leads to a lower risk sense of risk, perception of risk, and that's quite problematic. But is also backed up by some evidence, right, which is that there's lower rates of infectious disease in rural areas. So you're combating something that has some credibility. And also around the religious argument that you might look to using religious leaders as a means to shift that idea that purity on a spiritual level relates to immunity on a disease level. So there's the sorts of things that tend to come out at the group level of associations rather than just collecting those individual data points. So what we think is that often there's a combination to do citizen engagement, which can be important to a range of different important outputs, I guess, that are valuable. Communication for development, social accountability, monitoring of projects, etc. Public discussion that's just valuable in its own right. So sometimes that's an end of itself in some of the interventions we do. But then also that we can do that kind of research I was mentioning above in terms of analyzing the data in a more nuanced fashion. So in methodological terms, if you're of interest, we're looking at often odds. So we're looking at associations and looking at the odds of, or the chances of someone who is of this demographic group, believing X compared to someone of another group who will have less of a chance of believing that, and what that means about targeting programming towards that specific group. So that's sort of, I guess, a real high-level view of the thinking behind a mixed methods approach that uses interactive media for social research and citizen engagement. And I guess for us, that's 3 capabilities. I won't go through those in detail, but we basically organize our technical capability around 3 elements which reflect that kind of approach. Obviously, research design and analysis, and the kinds of research that can and can't be done with these methods, and it's important to know their limitations. And technology and data. So one of the things you can imagine, and this is something we learned early on, is that if you want to scale up something that's a qualitative research process, but across large volumes of local language data that's unstructured, not only do you need sort of very sophisticated things like potentially machine learning approaches to coding the data at scale, which we do use, but you just actually need very, very good management of data and data flows so that human researchers are engaging with it in a very clear way, and the quality can be maintained with the data, and that's one of the things that we've been really focused on. And then finally, of course, and this is it's easy to overlook this, and I've seen this in the Ebola crisis when we did some work with IBM's research lab. There's an idea that if you just switch on a free number, or you just send out a message on radio and ask people to contribute, if you make it free, they'll do it. And that's a great error in this kind of approach, which is that the first reason why this works is because it's engaging, not because you're doing engagement, but because it's an engaging space, and that people value the idea of contributing to a discussion in which they hear people like them having a voice. So you have to curate these spaces very well, and what we've learnt and done a lot of research on is that these are invited social spaces, and so there are lots of different cues you can give to your audience to say, we want to hear from women, we want to hear from people from this area, and they work if you get them right, because you're inviting people to engage, and you have to configure that quite carefully. So engagement is a non-trivial part of the whole exercise, is what I would just emphasize. It needs to be done very well for it to work. So those are the 3 capabilities, and then a standard, and I think within given time I want to open up to questions. I go into just a few more details about what those elements involve. I might, if that's okay, just skip through these 3 slides. The kind of detail that goes in terms of analyzing the data technically, and that media engagement, as I said. But I guess one of the things I just want to emphasize here, because I won't talk about methodology or the technical stuff in detail, but I would just say that it's the ability to use local language fora that actually can really matter. So if I'm in Western Kenya and I can do this in Luo, or I can actually generate a far more inclusive space for discussion than I can if I'm doing it through English or just Swahili from Nairobi. And so designing around, a simple way I like to put it is, what we tried to do early on was turn the methodological problems into our problem rather than the audience's problem. So it's easier for me to ask a question on radio in English, say, yes or no only, or A, B, C, or D. Don't tell us who you are because of data protection reasons, etc. And we will, it's easier for us to analyze the data. But that's not what engages people. So you have to let them treat it as a social space, which often means they will say, this is what I think. My name is X. Please greet my aunt. And the radio presenter will want to read out the message in full because it's about creating a space of discussion. And so you have to allow that space to be what it is and actually sort of leverage that rather than shut it down and turn the challenges into methodological challenges that we address on our side. So this just gives an example of how a research process works. We sort of go through that from engagement to evidence. And at each stage working with a partner to understand how are we designing this around a particular target population and research question of interest. What kind of evidence would be valuable to decision making. Deliver those interactive shows and then analyze that kind of data that we've talked about already and then turn it into evidence. It's pretty basic, but that's the kind of cycle of the work we do with our partners. And a range of different types of projects. So that this is a type of solutions that we tend to have worked on. So civic engagement and social accountability, which is very important in the space of government-citizen relations as well as service deliverer citizen relations. Accountability to affected populations, which is very much a specific area in the humanitarian space, but it's very, very important to, it's a growing area of concern. So trying to really ensure that that feedback loop from citizens is part of the design process of projects. A range of social and behavior change work that is often focused on health and education, and often specific issues concerning youth as well. And then broader sort of research where we've been doing the diagnostic sort of side of things first and then thinking about how that might relate to a program of work. So like the example I gave with polio, getting that initial diagnostic and then thinking how could that relate to programming interventions that come afterwards, including media and communications interventions, but they might be on the ground ones that are led by health workers, etc. So trying to integrate with other program partners, and that's something I'd emphasize. It works much better if we are working with program partners to try and support their work rather than just a complete separate standalone piece. Yeah, you can quiz us for reports, research reports, as well as just more sort of higher level briefings on any of these projects so we can give you some more details. So this is just a really quick sense of what we did in UNICEF in Somalia. This has been a long-standing engagement. So working with a network of radio stations across all 3 zones. Now, used to reach, when it says the radio shows reach 70% of the population, doesn't mean they're always listening, so that's the sort of scale of it. And the kind of engagement that we've achieved over that period of time, which is over 50,000 who have participated as unique individuals, and then a range of messages on lots of different topics. So this is just a rough high-level sense of some of the scale of that. And these are the kinds of topics that we've looked at to date on the left. But basically the point is it's a very plural approach, so it can adapt itself to a range of different themes and topics. And this doesn't include ones that are relevant to you, but suggests that there's no big reason why we could not include other themes of relevance. And then you get a sense of the age of engagement, especially powerful for hearing from young people, which happens to map onto the demographic group, but not as good from hearing from older people. That's very clear as well. We have, we find that that's a much harder demographic to engage with. And that can be changed, but some of the topics we've been, in this context, engaging on have been ones that have been of a special interest to parents, for example, who tend to be in the 15 to 29 age bracket. And that's because of the focus with UNICEF. And certainly very strong gender representation, which is surprising to many people who know the interactive radio space and think of call-in shows as ones in which young men dominate. So again, the point being that you can curate these shows in very different ways, and that can change the demographics of participation. And what we found, is that engagement sort of grew over time, and I think that's cumulative, but you just get more and more engagement, and then you have basically, with UNICEF, we have this repository of people who have ever listened to this particular show called Kalkal, which is health worker, and we'll then tell them, oh, the next show is going to be on X topic, and you build engagement over time, and that makes it more rich. And that's just the seasons over time in which we've heard the messages that we've received. So I think I gave you some examples already around polio, but just to give a sense of this is an example around whether boys and girls should receive the same level of healthcare. And so this is a negative belief I'm sorry about the spelling error there, but a negative reason for why boys and girls should receive the same level of vaccination. And that is to say that they shouldn't. So people who thought they shouldn't receive the same. And the reason is that of vulnerability, which is to say that they think that girls are more vulnerable than boys. So it's a negative reason but it's one that in a sense supports girls getting more attention. And so that jarred with some of the expectations around the program, which is around equality for girls rather than girls receiving less health services and access to core social development priorities. So this is in a sense something that can be worked with to support more access for girls. And then beliefs varying between demographic groups, as I mentioned before. So this is about FGM, FGC, and what we found is quite different reasons in southern Somalia, whereas Somaliland, in terms of why it's okay to accept that practice. And what it's saying is that in southern Somalia, see if I can get this pointer to work. There you go. In southern Somalia, religion is much more of a reason why this practice is okay. Whereas in Somaliland, relatively, this is not an absolute, relative to southern Somalia, the reason is much more around sexual control. And there's around sort of like a marriageability that attaches to that as well. So you get very different senses of what is a dominant reason for a particular practice, which obviously has an impact on programming choices. And this is shows how beliefs are linked with certain practices. So I said we can also look at associations here. So people who perceived that people living with HIV/AIDS are accepted in the community. So if they perceive that those sorts of people are accepted, they're much more likely, relatively, to request an HIV/AIDS test during a pregnancy. So the social stigma around acceptance has a big bearing upon a practice of an individual, even if they don't think they're at risk themselves. They're willing to undergo the test because they don't see a stigma attached to it. Not rocket science, but what you can imagine is that if you can start to move these over time, you can start to see changes in those associations. You start to see an indicative direction of travel of the effectiveness of a program. Yeah, I'm going to not go through that. This is just how over time we've built assets to enable us to do this coding and labeling of data at scale, combining human and machine approaches, and develop sort of interfaces that help our research assistants work with this data very quickly. And that just builds a lot of assets. So in one particular country, what we've found is after a while in Somalia, we can do any kind of work because we're really ready to, we've built a range of assets around language resources, the media landscape, the ability to operate that allows us to work well. And I think we'd like to think that that's the best way to work country by country because it's sometimes easy to think you can just switch this on, but it doesn't quite work that way. You have to sort of build the capabilities in country a bit more around language, around media context. But we've found that that's a lot more is possible there. And that's just how we've used that we've used that capability then suddenly for something quite different, which is nothing to do with radio, which is a very large-scale feedback mechanism and information program around cash transfers, which enable people to send feedback on whether they were able to access cash in an emergency. and then feed that back to program partners and very quickly diagnose where there were bottlenecks in the system. We couldn't have done it without the capabilities we built to manage that kind of SMS data at scale and to analyze that data, but it was quite different to the traditional radio program. So I think at that point, maybe Josh might have stepped in. I think we've got about 15, 20 minutes. I hope that's a useful amount of time to maybe dig deeper. But yeah, thank you, and apologies again. So I will open it up. Oh. I guess, oh, there, all right. Okay, so we were just, I guess, just very quickly, as we think about it in terms of, I think, agriculture, forestry, the livelihoods in sort of, as they relate to the environment, one of the things that we've sort of realized is that it's, again, a kind of, some sectors are more or less like this than others, but that the problem tends to be the way that, you know, the directionality of decision-making and policy formation and expectation around change in the community tends to go from, you know, a top-down sort of model. And that's a very hard model to sort of completely change, because obviously policy takes, you know, forms in lots of, especially when it concerns social dimensions of a policy formation process. The consultation bit sort of tends to be an afterthought for what is otherwise a you know, a relatively more hard science or driven idea of what the answer is. And so I think what we've been thinking about in terms of how we could support partners in the agricultural space, for example, who are trying to tailor more effective programs and quality programs to smallholder farmers, is sort of how we reverse that cycle, trying to understand diagnostics at the smallholder farmer perspective, for example, first, and then feeding that up into the set of actors that are working at the implementation level, as well as into policy dialogues above. So, I mean, crudely speaking, trying to sort of invert that process as much as possible. And yeah, and I think in terms of how we think about how we might be valuable to you in different programs, so yeah, the first is around understanding this value chain and how the community, you know, beneficiary, client, citizen perspective can actually unlock particular issues with the value chain in any area of work. How that might lead to the uptake of improved inputs or lead to different practices because of an understanding of what are the reasons why some sort of expectations around an improved practice don't work. The second, I guess, is to create spaces in which citizen evidence shapes policy dialogue and decision making. And that could be, you know, at a county level or a national level. But we do think that these are discussions which, as I said, can produce evidence, but they can actually be very valuable to the way in which policymakers are relating to citizens. So that can be part of the design itself, sometimes bringing them in as, you know, members of a panel discussion on the show, for example, or, you know, there's ways in which this leads to something that's more actively programmatic on policy debate and dialogue. The third is trying to use this sort of data to be part of the program process itself. So that might be used early on as an initial diagnostic, but that the evidence that can be generated from this on an ongoing basis is useful to the monitoring of programs and their adaptation during the project or program lifecycle. And that makes these programs more effective, but hopefully also more accountable to target beneficiary populations. So this is not something that then is just left to, you know, very basic monitoring and then impact evaluation at the end, but actually becomes part of generating citizen perceptions of effectiveness and value early and through the project lifecycle. And I guess the other thing is, looking beyond this, if it's at scale, can we actually think about how this data is important to understand wider patterns? So can map on as a layer to other data, including in particular, you know, bioscientific data, and help us understand certain patterns. So this is much more about sort of layering data and data fusion and thinking about options to represent this stuff and see new insights that we don't see without that social dimension. And I think there I might have got to the end. So, thank you. Yeah.
Thanks both of you. So we've got some time for a quick Q&A, and show of hands, please. And we'd like to sort of take 2 or 3 questions at a time, unless there's a reason to take them at once. Yeah. So, Ramani, you had your hand up. Anybody else? Carl? And a third? Well, we'll start with those 2.
Yeah, sure. Thank you very much. I always put my hand up first, and similarly, I'm sure there are people who love talking on radios. Yeah, so when I come to work in the mornings, the FM station always has, and very often I've started recognizing same voices.
Serial callers, they're called.
Serial callers, yeah. So I'm just wondering, how do you make sure that, you know, the demographics of participation, that you're actually targeting the right audience? Because you showed all these young Somali boys who are probably just loitering around without jobs and sitting and listening to radios. And I'm thinking, here are young mothers who need to be told about the importance of good nutrition. They're busy feeding, busy in farming, busy collecting. Having been a young mother once upon a time, I know how busy it is. We don't even switch on the radio. There's no time. How do you capture those kind of...
Great question.
I was just wondering, like that Somali example you had, I'm just wondering, when people are listening to the radio, don't they influence each other and each other's things? So when you're looking at the associations, aren't they kind of not, they're not independent kind of observations? So I'm just wondering how you factor that into the analysis. Yeah. The other thing is, I could really see a lot of potential for this for informing the design of a program. But when you're targeting kind of very specific geographical areas, is there a way you can get kind of feedback or elicit some kind of localized discussion, or is it more applicable for kind of broader a whole region when you're trying to get feedback? So it's more appropriate for kind of bigger programs or projects that are working at scale.
Can you just remind me the first one? Just let me make sure I got that right.
So when you're listening, if you have a group of people, if someone's commenting, you got.
I got it. And actually, they're all 3 questions are sort of related, and I'll explain why I think they are. I'm going to have my cake and eat it as well when I answer your question. The first is that you can design these very carefully and well to change some of these dynamics. And that was what a lot of the research we did originally was about. And we were looking at variations in who participates in different shows. And I remember we did an analysis of all of the engagement with a Luo language station in Kisumu, for 2 weeks. And we found variations, right, in terms of who participated when. And that's when we started to looking at, well, what are the qualities of these different shows that do that? And some of this just comes down to basic stuff, right? The time of day, in terms of who you want to reach. The presenter, if it's a female presenter, that has a considerable effect on, and then the design of the show. So one of the things that we do with the design of the show is, there will be call-ins. Call-ins are not actually crucial to our analysis, so they tend not to be, a data source in themselves, although we will get the transcript. It's the text messages that we're especially collecting at scale, because we'll create a free number, and the call-ins animate the discussion, but the text messages are contributions. And so one of the motivations is this idea of contributing to a discussion. So the first thing is, who are you inviting to participate? And it's amazing how much of a difference the presenters queuing, like sending a cue to certain demographics. I really want to hear from you. I want to hear your voice. How much that can actually already turn this a bit. The other thing is to read out. So it's voice into a public discussion. It's the classic thing of voice and recognition. So if you then read out messages from people who are like the people you want to hear from very early on, and say, oh, I'm hearing from this woman here and this young person there, you are, again, setting a message about what the space is. It's an invited social space. And you can't completely turn the things that you describe on their head, which is to say, especially that there are sociocultural parameters which condition ideas of who has a voice in a space and who doesn't. And young men tend to think they have a voice in every space. So you have to, there's only so much you can do to shift big sociocultural norms, right? But you can, what we found is that there's actually a paper that I think will be published soon that looks at household survey about this. What we found is that, when we analysed the different drivers of participation, access to radio, mobile phone use, demographics, different sort of expectations or satisfaction with democracy, because we were looking at public discussion, current affairs shows. What we found is, an independent variable with a clear effect in a multinomial, regression analysis, trusting the presenter and knowing other people who'd ever participated in these shows were significant determinants of whether someone ever participated. So our point is that this is what sociologists call sociability. So who feels that they can speak amongst other strangers? It's a classic question in modernity, right? So why is it that coffee houses and salons were places where people felt they could talk about public affairs with strangers? So you have to sort of configure ideas of sociability through the way you design the program. And the morning shows don't do that, right? They just sort of say, we'll just take, it's entertainment value, say something outrageous, young men say some stuff outrageous, they get on, they become serial killers, they become characters in the show. It's sort of, and that's just one format amongst many. So when we're able to achieve sort of really 43, 45% female participation in shows, it's because of design. And that's why I said the engagement stuff is easy to trivialize, and people will just want to turn on the free short code, ask the question, expect everyone's going to come and answer. It doesn't work. It's not perfect, but it's possible. The second point, and this is where I'm going to have my cake and eat it as well, and it relates to Tor's question as well, which is that it's actually really valuable to understand what dominant voices also are saying. So, this might be relatively more vocal population that you'll end up hearing from. It's not going to be a perfect representation. But they are influencing a social space, which is the interactive broadcast show. And that is where social norms are being generated. So, in a sense, you're actually finding out, yes, a slightly skewed version of what the social discussion is, but one that is powerful and important as well. And it's worth trying to get that into account. So you're thinking about this as understanding social reality as it is through this space, rather than trying to strip out that social reality and just take people at their doorstep with a questionnaire and hope that you've stripped them of all the things that influence how they think, which is a bit of a problem with surveys anyway. So it's very much a qualitative approach, right? If you think of a focus group discussion, it's very much about, and I think that's why I try to crudely, visually represent this in terms of the lines and the dots. So in a focus group, the point there is not just that there's dots that are less dots than these dots, but those dots are connected because they're in a discussion. And so they're always going to be influenced by what others are saying in that. That's the nature of a qualitative research exercise. You're trying to surface things that exist in between people in a discussion and understand what that in-betweenness is. So why I think we characterize that as this with lines rather than just the dots is because it is also similarly a discussion space. And it will be, have some effect of reacting and responding to what's going on in the show. So you have to design the show very well. And early on, not allow it to be a space in which one view or another view is being expressed. So how do you cue for presenters like journalistic standards? Well, we've heard here's a view on this side and here's a view on that side. How do you allow it to be a space where people are responding to some balance of views in the way that they're sending messages in? That becomes crucial to the design. But in the end, it is a space in which there are dependencies of the data rather than independence. And that's why it's important to study it at a collective level. And I don't have a slide on this, but if you can imagine, we'll get, say, 6,000 messages to a program which is run on a few radio stations. We'll get a bunch of all those messages. We'll take 1,000 and we'll develop a coding frame. Two different qualitative researchers will develop a coding frame from that data and try and account for a mutually exclusive, completely exhaustive list of themes and sub-themes. And then we'll think about collapsing those coding frames based on the research design. But that process is at the individual data level. And then we label all of that data, but it's at that point that we look at the frequencies of different themes at a group level. So yes, there is that sort of biasing that goes on to some extent in that because they're responding and relating to each other. But we're not taking very individual data points at that level. And then when we look at associations, we'll be looking at a group level, not at taking individual data. So that's the kind of way in which we try to conceptualize this, right? So if you're talking to qualitative researchers, they understand that whole biased relatedness of the data. And if you're talking to survey researchers, they will understand, the kind of ways in which associations run on independent data so with this mixed approach, you have to sort of find ways to manage it in the middle. Now, having remembered the middle question, the last question was about targeting and focus. And that's where this is not perfect, right? Because I think you do need to know, can you work in a place where the media environment does allow you to do this kind of, and use this kind of approach? Not every location and context does. And yeah, there's sort of real operational questions about being able to focus on a particular area or region or group. I think the more narrow it gets, the less relevant is the method. But if you're talking at, say, a county or region level, I think it does retain its viability. But once you say, I really just want to talk to Luya who plant, something, in a particular sub-region, it's like, well, you don't need this, really, But if you want to understand how Luya who plant sorghum in this area are thinking on relating to access to markets, it might be very interesting to get the whole perspective of the counties, on markets and access, and how the Luya experience compares to the experience of others, and why that might be a determinant of issues of access, for example. So the comparison could be actually very valuable to understand how to unlock a particular target population's experience. Yeah.
Thank you for your very nice presentation. I've just been wondering, do you do any advertisements or marketing prior to the shows on radio to make like the citizens aware that this is coming up, and on topical issues probably increase participation?
Absolutely, that's so crucial. So right now, and I don't have the data, this also speaks to Tor's question. Right now, last night we did a show. That's Carl. Tor, sorry, Carl, sorry, Tor. Oh my, Carl, I got that wrong. Yeah. Sorry, this is my Scandi airbrushing of individuals. Sorry, someone's not happy about that. Sorry, Tor, sorry, Carl. We had a show in Kakuma yesterday. It's about refugee girls' education, and also in Lokichokyo. It's sort of about access to education for girls, both amongst host and refugee communities. It was really hard to know whether we're going to get engagement from those target populations. I don't know how it went. I don't know if we have the answer yet. But we know that we were up against it. It's a pilot to see if we can get an engagement in these radio shows. There's the language issues. There's lots of issues there. And so a lot of the effort around it was to work with program partners who are on the ground delivering this education work, the Windle Trust, others, who have community mobilizers, etc., to get an interest in the show and engagement with it, and to build awareness of it, including advertising it on the media, but also through other figures of authority, so church leaders and people in the school, associations, etc., to try and generate engagement, so that this is a space for discussion for you, like everyone come and listen and join in. And sometimes we have to do that. So in other contexts, we don't necessarily have to do it as much, but I think it is something where we do put a bit of focus, because it can be crucial. And if you can imagine in your own media habits, it takes a while to suddenly start building the habit of listening to that show at that time because you like that presenter. So that's also why choosing the show and the presenter in the first place is actually quite valuable starting point. Getting that right is a good start. Yeah.
Don't confuse him more. So I was just, we've talked about this before when we met last time, but it's, I think some of these approaches would be really interesting to explore in the context of land degradation and restoration, because we often tend to treat farmers as sort of individuals. So we do household surveys and so on, but we look very little or in a limited way at the collective. And so what that whole discussion and that collective, those dynamics at that level, what that actually means in terms of people's perceptions of degradation, but also what it means in terms of how people think about restoration and biodiversity. And and in the context of eCraft, we often talk about diversifying agroecosystems, for example. So what are their perceptions of that in that sort of collective space?
Yeah. So I think that's a really important point, and I just give an example which I think shows two sides of value to this. So we were doing a project in Cape Verde, as you do, on infectious disease. And so it's a public health project, and it was and one of the elements is about vector-borne disease and about how people use water and how they, put lids on especially in peri-urban settlements, so how they look after their water to minimize infectious disease. And so if you ask people, if you say this is a public health, at an individual level or even as a collective level, if you say this is about public health, how do you look after your water? And people will give you, line for line, the exact reasons, the knowledge, the attitude and the practice for how they look after their water, keeping to the top WHO standards that you expect. But then if you open up the space for discussion, and often this doesn't always start with radio, it might start with focus groups, and you sort of talk to people about their reality, their precarity, right, of being in an informal settlement in a city on an island which doesn't have any fresh drinking water. And so there's only one salination plant. And every now and then, quite unpredictably, a water truck turns up and people have to get their water. And when they do, they get their water as much as they can of it, and they come and store it wherever they can. And they might sell it on to other people if they've got a lot that time. So there's a whole sort of water economy that's completely not a public health sort of put lids on it because of mosquitoes. It's just survival and precarity and dealing with it. So you start talking about that, and say, of course, we take as much water as we can, we store it wherever we can. It sort of sloshes around, basically, right? And it's got nothing to do with putting lids on it in the proper container that was advised that you should put your water in. And the thing is about that is it's not just about a practice that goes against the public health expectation of and the norm that there's a norm that's built out in a little silo. There's a norm that's built up around the public health expectation, and it's fine. It's very stable. But the reality is that people are not living in that silo. They're living in a complex set of needs and expectations of what everyday life needs to deliver. So there is another norm that says it's perfectly fine to just store your water whenever you can when you get it, because we all know that it's a precarious existence. Can't trust the suppliers. And and it's okay to go and sell it on. And so there's another norm. It's not that the norm you care about is problematic. It's actually probably sometimes it can be okay, but there can be other countervailing norms that can override them, and that's just the reality that we live in, which is kind of complicated. So I think sometimes it's also the social level of this is about surfacing things that you wouldn't otherwise expect as well, that might go against the hypothesis. And that might lead to a understanding what needs to be done. And that maybe it's not all just about the individual and their lack of knowledge that needs to change an attitude, that needs to change an individual practice. But it's about a policy question, which is, if you really, really want to address this issue around mosquito spread and dengue and Zika in peri-urban prior, you need to think of it as a policy level. It's not about the behavior of the individual. It's about this policy question that's not being addressed. And I think those sorts of things become, by opening up the space and letting it be open-ended questions and discussion, other surprises start to be surfaced, which are valuable to planning and decision-making.
Thank you. I really appreciate the way you've been able to capture voices, across the different countries that you're currently working in. Are you looking forward to a time when you can actually capture Africa's voice?
Singular, yeah. Oh, this is a good question. So I gave a talk in February to some students in Cambridge, and I titled it "The Bureaucratization of a Good Idea." And what I was trying to say is we had a great idea from research that we wanted to take out into the world. And I've learned in the hard way in the last 3 years that an idea that sustains itself in the world needs to be institutionalized and bureaucratized and sometimes sort of, limited in order for it to survive. Like, for example, what's a sustainable revenue model for actually keeping a non-profit alive and all of those sorts of things. But if I go back to the original purpose and intention, we did a pilot with 9 small radio stations in 8 sub-Saharan African countries. And what we wanted to do was see if a discussion on a similar theme elicited rich engagement and insights, and then sort of share them and let the radio station in Masaka in Uganda say, well, we've heard from some people in Chipata in Zambia. Though this is what the people in Chipata in Zambia think about the same issue, and this is what we thought. And just trying to get what we've called, dialogue at a local level that was still continental. So like it's, and for me that goes to this thing, which is not. I think this is a continent of plurality, and that needs to be respected. But there's something exciting about maybe connecting this stuff up, and it's quite powerful if it does connect up. So for me, that was the original ambition. We're a long way off that. We found that that's not a very easy ambition to allow to survive. But one of the things we're doing at the moment is trying to take what we've learned and the model to date back to the media space and say, can we do it with media? Because that could, if we can create value for media, then we can sort of scale and replicate it in new ways. And then we're not just doing it with the kind of aid and development sector as a project-driven thing. That's something that's a bigger phenomenon. But as you know, but I love that idea. I just haven't worked out how to put it into reality. Yeah.
How did you know he was from Zambia and pick a Zambian?
Ah, great. I suppose. Yeah.
And we probably may have one more, but we may finish it.
I should let Lee do it first.
Okay, well, mine is actually from one of the online listeners, Mika Bourne. Oh. So yes.
We have people listening online as well.
Cool.
And we've been WhatsApping because it's just been fascinating. And so Mika and several of us are involved in this engaging decision makers with evidence. So the question is around, do the decision makers respond well to the evidence that you present? And then how do you have examples of how you presented the evidence back to decision makers?
Yeah. That's a really good question. So a lot of our decision makers tend to be programmatic people within programmatic organizations rather than government. And so there are a few different examples. I think one is where we work with an organization that themselves is trying to has the influence agenda. So they're the ones who have got the relationships, and we're providing evidence into that space. And I think that's a really important way to do it, because evidence by itself, I don't think, works, right? It's got to be relationship-driven and credibility and trust-driven, etc. So where I think that's been more successful is that we might work on a program, for example, on keeping adolescent girls in school in Nairobi and Siaya. But the other program partners are working with county-level line ministries, etc. And so we're bringing what were insights into a workspace rather than into a advocacy sort of effort where we're shouting down authorities. It's actually trying to bring the evidence into a workspace and understand what do these insights say about policy and program choices that can be made. And if that happens, then we know our place, which is, we need to be seen as some trustworthy and credible in terms of the evidence we produce, and others can then take the interpretation and influence agenda forward. I think that works really well for a lot of areas, and it's much better. I think there's another example where we've actually tried to work more actively with government, and that's with sort of local government in Somalia, as it happens to be, so emerging local government. And we've learned that it's tough, right? So if you're bringing this, especially if you think like citizen perceptions of the effectiveness of service delivery or something like that, or provision of security, you have to be really, really careful about how you manage this space. And I guess one of the things that I would say we think is very important, we're trying to create spaces of public dialogue. And that means that everyone kind of needs to come into the space. And if it's a space that's tilted towards shouting down government, then that's not going to work, and they're going to just switch off. If it's a space that's tilted too much to government, then it becomes a propaganda space, right? And so there's a healthy tension between citizen voice and the need for authorities to perform their authority, to garner legitimacy, etc. For me, from the governance side of the work that we're trying to do, that's really exciting. I actually think that getting the tension right is the key. You can't. And that means that the evidence plays a role within that, and it's not the top of it. Actually, you're trying to create the relationships and the sense of engagement on different sides, through which then the evidence becomes part of that discussion, that process. And so what we did in the shows in Somalia and worked, but then we found not everything's predictable, and suddenly you can get a naysayer who suddenly says, no, don't want to do this. So it's very political spaces. But what we would do is we'd gather citizens' views on a particular topic that the government wanted to hear about. So they wanted to hear about X, perceptions of service delivery, or, and then we would gather those views using the advertisements of the show over a couple of weeks, and we'd analyze that and look at some of the dominant themes that came out, and we'd write a little briefing, and we'd take it to the government and the media and say, okay, this is what we've found out. And they would engage with that, and then we'd think of, well, if we're going to script a discussion now with you on air about citizens' views, these are the things that we think must be in there because they're coming from the evidence, but you have a chance to think about it and respond. You're not going to be put on the spot. And then bring them into the studio, the discussion on that. So I think there's design questions that enable it to be a healthy tension where there's enough, that people, the authorities feel that they're not being shown up and sort of ridiculed or put under pressure, that they're working with them, and that this becomes a way of reconfiguring their relationship with the citizen or the community, which is around what are the sources of legitimacy, right? So if this can work, then they can be sort of, they can show their success of listening and hearing citizens' viewpoints, engaging with them, accepting some, not accepting others, but saying, well, we will do this. And we come back to that space in a month or a week and say, we have acted on this, but we haven't acted on that. And that reconfigures their sources of legitimacy vis-a-vis the citizen in new ways. That's a bit idealistic in the extreme, but in everyday sense, I think it can be quite powerful. And one of the things we learned when we did the original research was, there's a world of 3-year plans and budgets and, how the world needs to look ideally. And then when was in Chapata and I'm sitting at Breeze FM, listening to these shows in the morning, not shows that we created, shows that are just going on. Like what's happening is the market, and this goes back to the serial callers as well. There's someone who rings all the time, but actually when we interview him, he thinks he's representing people in the market who don't have a voice. And so he's performing a representative function in his view of the world. And he has about 6 phones, and he's ringing through all of the phones to get on air. And he talks to everyone. Everyone comes to him in the market and says, this is what our issue is of the day. And so then he feels he's doing a representative thing. So he then has his voice on air, and it's like, the rains have come, the markets are flooded, the council's not doing anything about cleaning this up, and it's really bad. Now, then you go to the government office, and the provincial secretary and his assistant are listening to the show, and they're finding out what is driving people's concerns, and then they're going back down into their sort of civil service lines to find out, well, is this true? We should do something about it. It's a complete inversion of a planning process, right? It's reactive and responsive. But if you look at that reality of that province, it's under-resourced. It can't achieve its plan. It can't, it's got a plan, but there's stuff that it's always just firefighting. And the problem-solving logic doesn't come up the civil service because people don't want to report problems. So this is another source of insight into what the community or the citizens are saying is an issue, and they react to it. And it's not what you would want an ideal governance model to be, right? It's reactive, it's short-term, but nevertheless, it's actually important to the way in which the relationship between authority and citizen sort of carries itself out. I wouldn't idealize that, but it does, serves a function, I think.
Susan has a question, so I'm going to let her ask the last question, and you're going to ask the question after we've finished.
It's actually not even my question. I am a representative. I'm asking a question on behalf of online listeners from Sahel, so I'm one of those serial callers representing other members. And so the questions are, how do you deal with the cost of the shows? Who pays for them? How do you assess the number of listeners of the radios, and how do you ensure that bias is avoided?
Okay. So the costs of the shows, we tend to, by and large to date, we've paid for airtime with the shows because it's the easiest way to ensure that you get what you want. And then you work very hard to ensure that actually it's done in the right way. So that is a simple answer. I think we would like to have thought other models. There are other models out there. But we think the shows are a very important, crucial research instrument. They're a means to an end, and you have to pay for quality, and you have to be able to demand that. Others do it as a media development approach, where they build a capacity of journalists and presenters in order to have other space of airtime to do stuff. So that's, I guess, that answers the first question. The second question was about the number of listeners. Yeah, that's that's the hardest thing to know, is like who's listening to a radio show. So there's lots of proxies for listenership. In Kenya, which is a very sophisticated radio and TV market compared to the rest of the continent, you have reasonable data on listenership that's produced by a market research company. But when I talk to media houses, they don't really feel like it's granular and enough for them to really know who's listening to what. And so that is an issue. So that drives advertising, right? So they need to, advertising is predicated on some idea of the listening audience. In lots of other places, like in Somalia, we're using sort of broadcast maps, understanding the reach of the radio as a whole. And so we did a survey a few years ago in Kenya and Zambia, and we got a kind of 8-to-1 ratio of those who have ever participated compared to those who listen to these sorts of shows. But that's very crude. It's like, every presenter and show and station is going to be different. So I think, I wouldn't think that that's a standard ratio. Obviously, we get the participation data. We know who's participated. We get their demographics. But the listening audience is a harder one. And so you have to go with, I think your choice of station, your choice of show, your choice of presenter is already about thinking about who's popular. And you can do that quite quickly even with qualitative research. So if you know you want to work in this part of Turkana, you can quite quickly you can do a survey of, and it's not going to be representative, but you're going to get a quick sense qualitatively of what people listen to, what's their media consumption habits, and test some hypotheses. We think this station, this show, this presenter is a good one. Quickly go and sort of test it out and iterate it. So I think that's important. I think the question of bias, if I'm right, is now not about the audience but about the media. And I think if that's correct, that might be a really interesting question to answer, which is that the media is also biased in this, right? So the presenter will have a view. And that is an issue, is to actually really manage and monitor and also train very well. Because we have had shows where it's a discussion about something relatively sensitive, a social issue that's sensitive, right? And suddenly presenters, as they're well known to do, sort of just go a bit off-piste and say, oh, well, this is what I think, or this is what my grandmother said, or whatever. And it can be, that can be not what you want to happen. So a lot of what we've tried to do is set up these ground rules and work with, ideally, presenters over time. So this works very well for the same reason of building engagement in terms of advertising the show. If you can work with this for a radio season, you build up a discussion space over time. You're able to sort of work with the presenters and get them to work, to do what you want them to do in the right way. So this tends to work as something that is over time rather than switch on, switch off. And that can help to really manage the media bias element as well. But we're pretty strict about how we work with the media.
I'm feeling a bit weak today, so we're going to let... Well, no, you've got to wait for Lisa to ask her question.
Yes.
And we'll let, so Lisa and Ramni, and then you answer, Sharat,
Okay.
because otherwise,
Yeah.
and that'll be the end.
Tiny question. I was wondering whether instead of producing alternative content, you ever have strategies of influencing existing content. What I'm thinking of is typically like anyone who drives to work in the morning might come across the classic 105 and so how often do you beat your wife? And then people call and they're like, oh yeah, my wife is really horrible. And then there's this whole generation of discussion about horrible social topics. So sometimes I'm wondering, as an institution or as an enterprise, whether you ever have objectives of targeting such horrible shows that reach so many people.
And get
Thank
excited.
you.
People get excited.
Yeah, they get so thrilled. And then there's this build-up of people talking about, yeah, I beat her 5 times. No, that 5 times is not enough. It's horrible.
Yeah.
Thank you.
So actually it was great because some of the questions, I had 4 here, which I'd combined. But my quick question, I saw UK Aid in your corner when you started there. And this kind of research through media it's been around. I know it's used a lot in the UK, for example. I'm just wondering, how popular is it with donors? If I wanted to put this kind of work package in my proposal, how popular is it with donors? Yeah, and just within that space, what kind of time scale would one need for an activity like this to get optimum results? We don't want to take it for 10 years, but something that will give us, depends on the space as well. I get it. So say one country, say Kenya. Yeah, so just give us an idea, please.
Yeah, okay. I think the first question kind of relates to the second one. I'm doing this relating questions thing. Because the reason for some lack of excitement about media on the continent is also about the phenomena that's described, and more importantly about phenomena that relate to Rwanda in '94 or the post-election violence here, and the role of radio and in both of these. So there is this sort of stigma attached, I think, to some extent to media, and I'll come back to that. But yeah, I think we haven't taken on that, that very large task. But I would say this, right, which is what you're really describing, I think, which is important, is in our research, the worst kind of show was the sponsored show, right, by the World Bank in Zambia on, PFM, public financial management, right? And so, some people, like it's in the day and it was soporific and everyone's sort of a post-lunch session in Chapata in Eastern Province, and some 3 experts come in and tell you about how to think about budgets, and then it's like, but this is of course about public engagement and citizen engagement. We want to hear from you. Like, no one rings. Some serial callers get on the airwave and just have a rant, and the whole thing just kind of flops. And it's like, well, that's exactly how not to do it, right? Which is that you don't come with expertise and load it and shove it out at people. You don't, and then expect them to get back to you and say what their view, because they've been very intimidated by that, right? There's experts on air already. And you don't sort of slot it in and say, this is our content, we demand that, this is exactly how. You have to let presenters do their job, right? And so there's something to be said about playing with existing spaces and existing shows and working with them and slipping this stuff in. And because we're not doing dogmatic content out and not dogmatic question, you must ask ABC, answer A, B, C, or D. We want the discussion. We're able to work with what's there rather than what's against there. And I think, from what I understand of media, there's only 2 things that matter, right? It's audiences and commercial viability. But they're very closely related. They have a much better sense of where the audience is and where they're going. Like, they're going where the audience is. So while it is, upsetting to listen to these shows, they're not doing it because they're making it up. They're doing it because there's engagement, there's audience there. And if you get an audience and listenership, then you've got the commercial piece sort of moving in the right direction as well. And so there's something to be said for using those spaces, which they're not morally wedded to wife beating, right? So the presenter isn't, the station isn't, the show isn't, the media house isn't. They're going where the audience is, they're using that. Yeah, they're amplifying it, they're making it worse. There's no doubt about that. They have an effect. Media has an effect. But I think working with their understanding of where the audience is and then using that to say, hey, would you like to do a social campaign on SGBV, and we can start with this kind of stuff, but we want to push the discussion in another direction, keep the audience engaged. If you come to them and say that UNICEF or the health ministry or whatever is supporting this, and they'll say, yeah, okay, well, as long as you don't mess with our space, right? Because you start we'll never give you Minor and Kenyani for you to do a sponsored show. Like, that was never an answer. But we will think about, something that we think will work, and a format that will work, that will surface some of this stuff. And then we might allow you to sort of then come back with some, hey, guys, this is not good enough. And we'd prefer you didn't do it through an expert. We'd prefer you did it through a great celebrity who says, you know what, this is enough. I don't want to see this stuff we don't need to be like this. Kenyans don't need to, do this. So do it through someone who's themselves valuable and engaging. And I can guarantee that's a much better way to change a social norm around this stuff than the expert, right? And says, actually, according to the CEDAW convention, this is actually not appropriate because that's not going to change much. So I think there is something to be said about working with these spaces, and that's really powerful. A phrase that was used for me was like, go where the people are. You have to go where the people are. If you start with their world, and then you can bring them on some change. But sometimes that means starting in spaces that aren't quite as palatable, but I think that's a better approach. Yeah, and then I think practically speaking on these sorts of, yes, I think donors are coming around because the social behavior change communication space is really opening up. So I think there's a sense that the CAP model is slightly, dying, I think, especially in the social change space, which is that you can do it on a very individual-based level. There's sort of a CAP sort of cognitive model here, which is individual knowledge, attitude, practice. Then there's a sort of behavioral insight stuff that's going on with behavioral economics and nudging. And then there's emerging very much an increasing focus on social norms and how social norms work. And I think in the social norms space, there's more and more of an appetite now for doing this kind of work if it's evidence-driven, right? And so it's not just media. So I think that appetite has grown, and that makes it very valuable to do this kind of work. I think it's also valuable if it can be combined with other hard evidence, so that idea of sort of layering data, etc. So it's an interesting addition to other kinds of evidence-based policy work. So I think that's when it gets really interesting. And I think I was talking to Constance just over email, about a project in theory, and if you can do sort of a piece that's in the beginning, it's like the project, the total length would be say 6 months, but maybe there's like 6 to 8 weeks of shows as a diagnostic sort of piece earlier on, that could be really valuable to sort of shape program design. And then you might have a communications element of the program that keeps going the whole way, or you might not, and you might just come back at a later period to see whether programmatic effects are there in the discussion space. You can come back, in a 3-year program, you might come back at another juncture to do a bit more work. So I think there are variations on that. But certainly I think to get some of this right, we found that 6 months is a sort of the minimum for doing something of value. So you can, and within that, the shows themselves would only be 6 to 8 weeks. But if you want to get the design bit right, the media engagement bit right, the analysis, the influence, you need all of that time to get it right. Yeah.
Thanks, Sharad. This is usually a very impatient audience, and it is lunchtime. They're usually out of here, and they've stuck here because I think it's been interesting. So can we show our appreciation to both Josh and Sharad?
Thanks, Josh.
Thanks very much, and I hope there's lots of conversations that follow up from this.
We're very excited about all of them, and we feel that this is the context of a relationship that really works for us, and so we're looking forward to it. Thank you. Thanks very much. Great to see you. Yeah, I'll switch this off.